My name is Catherine Janelle. My husband was involved in a car accident on March 6 in 2006. He was a pedestrian and he was hit by a car.
Catherine's husband was brought in with a devastating brain injury, required him to be on life support. He and his wife had discussed the fact that he did not want to be kept alive on life support.
That for him would be prison, and we all knew it. And so that's when we decided to let him go. And when the time came, I pulled out the health directive. I followed his request to the T, and one of it was organ donation.
In most patients, organ donation occurs after brain death. In a small percentage of patients, however, organ donation occurs after the heart stops. This is considered to be donation after cardiac death. In 2006, UCI Medical Center, like most hospitals in the United States, did not have a policy that allowed us to use organs after cardiac death.
He had to be moved to Western Medical. They had the procedures and the protocol to accommodate patients like my husband for organ donation. Yeah, watching all the paramedics and ambulance standing there trying to decide how to move my husband, it's not that I made a mistake. My husband had a chance to die in a hospital, surrounded by his family. But now I made a choice where he can die on the street, in an ambulance, where he won't be surrounded by family. And when we got to Western Med, and I had to sit down and talk to the administrator, check my husband in, tell him the whole story, why we're there, why he's being admitted, who I was. And that was bothersome. But I didn't want this to happen to another family. So I wrote a letter to Dr. Spiritus. And I told him about my experience and how I felt when they moved him.
I called Catherine on the phone and promised her that I would in fact make certain that a policy was developed. And within a year we had that policy in place. And we have now been successful assisting many other families with donation after cardiac death.
The stipulation of the program was I had to be involved.
Most hospitals have an organ donor council to assist in this process. UCI is probably the first hospital in the country to ask a family member to be part of that council, and in fact, Catherine is that person for us. We ask her, how would you feel about this? What do you think about this? What do you think families would feel about this? And I think that's really important for us because, we get caught up in the day-to-day issues, but it's really nice to have somebody that's been there, that's felt it, that's had to make that really hard decision, and to feel good about what we do.
His kidney went to 2 men, and they were doing well, and his liver went to another gentleman in his 50s who's been on the waiting list for a couple of years and who's doing very well. I discussed it with the kids, what happened to Daddy's body, and that we donated his organs. The first thing that came out of my daughter's mouth was, my 4-year-old, was, Daddy did good even when he passed away. And I said, yes, Daddy did good when he passed away.